If you work in a GP clinic and your older patients ask you about home care, you'll need a basic understanding of how Australia's Support at Home program works. So let's cover the essentials for you and your clinic staff. It'll only take a few minutes to watch and you'll easily be able to point people in the right direction. Support at Home is the Australian Government's in-home aged care program. It funds care and support services so older Australians can continue living safely and independently in their own homes. Instead of moving into residential aged care, the program provides funding that allows services to come to the family home. That might include help with things like personal care, cleaning, nursing, allied health, home maintenance, transport, or support with everyday tasks. The goal is simple: to help people remain living comfortably at home for as long as possible. Support at Home funding is based on care needs. There are 8 levels of ongoing funding, and the higher the level, the more support you can receive. For example, someone who only needs occasional help with housework or allied health may receive a lower level, while someone with more complex health or mobility needs may receive a higher level of funding, with more funding available for care services. The funding is used to build a care plan that supports your specific needs and goals. Support at Home services fall into 3 main categories: clinical care, independence, and support and everyday living. Clinical care, which includes services such as nursing, allied health, are fully funded by the government, so people should make the most of them. These are the services that are proven to help people stay safe at home for longer. Independent services like showering, transport and social support, and everyday living, which covers things like cleaning, meals and mowing, attract the government's means-tested co-contribution. That means participants will pay a fraction of every hour of services they receive. You can check out the co-contribution calculator on the My Aged Care website. There are 3 additional funding pathways for short-term services. Assistive technology and home modifications help with things like wheelie walkers, mobility scooters, or safety rails. Short-term restorative care is designed to help someone regain strength or independence after surgery or a hospital stay. And end-of-life care, which allows people to stay at home in comfort and with dignity in the final days of their lives. These pathways are designed to make sure people receive the right support at the right time. To access Support at Home, the first step is to register with My Aged Care, either on the website or by calling 1800 200 422. Everyone 65 and over should do this regardless of whether they need care or not. It means they can move fast if they need to with care in the future. They can then apply for an aged care assessment. An assessor will speak with the person by phone or in their own home to understand their health, daily routine and what support may help them stay safe and independent. The assessor will then recommend a level of support. Because of the high demand of support at home, there is a wait list. Registering early can make a huge difference in helping people remain independent at home. Once assessed and approved, they can choose a provider to help them coordinate their services. That's where Invigor comes in. We help people understand their funding, design a care plan that reflects what matters to them, and organise the services that allows them to keep living the life they want. And just as importantly, we help guide families through the process so they're never navigating the system alone. So those are the basics of the Support at Home program. You can always contact us on our website at invigor.com.au if you've got any more questions about how to get started with your home care.